my name is Mimosa and my last name is Pham, Pham, and today I will be performing the CPE for medical administration for pediatric. Okay, first off, I will wash my hands. And here I have my order and my mark, and now I will be verifying the two of them. So I have Violet Parr, medical record number is GAL 151420. Date of birth is July 4, 2012. She's a school-age girl. She has no known allergies, and Dr. Andrew wrote an order for clindamycin 120 milligram PO every 8 hours for cervical lymphadenopathy. Okay, so everything matches. After verifying my order with my MAR, I will be doing my first medication check. So I already I took my medication out to check for expiration date for my first medical check, and I already locked the cart. Okay, so here I have my medication check, so I'll be doing my first check. I will be checking the patient identity, medication dose, route, time, expiration date, and then I will document later. So patient, I have Violet Parr. The medication is clindamycin. The dose is 120 milligrams, and the route is PO. The time is now. I will document later, and the expiration date on my medication is September 2021. So it's safe. Okay, so after my first medication check, I will be calculating the dosage and then doing my second check. So my patient is 68 pounds. I already did the medication for the 20-hour dose. My patient's 68 pounds, which is 30.90 kilograms, and my 24 hours dose I already calculated is 360 milligrams, which is safe because it's between the therapeutic range. The between the low is 309 and the high is 463.5, so it's between those range and it's safe. Okay, and and then another thing is the order is 120 milligrams. I have tablets here for PO, and each tablet is 60 milligram, and I already calculate the dosage too, which is 2 tablets equaling, each tablet is 60 milligram equaling 120 milligrams. Okay, so after I do my dosage calculation, I will be doing my second med check. So I have, my patient is Violet Parr. My medication is clindamycin. The dose is 120 milligrams, which is 2 tablets because each tablet is 60 milligram. The route is PO. The time is now, and I will document later. The expiration date is September 2021. So here I already finished my first med check and my second med check with the patient, the medication, the dose, the route, the time, documentation, and then expiration dates. Okay, so after I finish with my second med check, I make sure that I lock the med cart and I'm ready to proceed into my patient's room. When I come into my patient's room, I'll be sure to introduce myself. I am Mimosa. I'm the registered nurse for today. I will be verifying the patient's I will be verifying the patient's identity again. I will be addressing the patient's parent as well as the patient. So the patient is Violet Parr. Medical record number is GAL 151420. Date of birth is July 4, 2012, and she has no known allergies. I will also be verifying the information. I will also be verifying her information with the wristband, and everything should match. After I introduce myself, verify the patients, I will close the curtain for privacy, wash my hands, raise the bed to my working level, and then now I will be and then lower the bed rails. Now I'll be informing the patients about my reason for my visit today. So I'm here because I'm giving the patient clindamycin for her cervical lymphadenopathy, and the patient is antibiotics that treat bacterial infections. that fights infection in the body, and she has enlarged lymph nodes right now, so that, from infection, so that's why she's needing this medication at the moment. I will also be informing the parents and the patient about the side effect of the medication, such as nausea, vomiting, stomach pain, mild rashes, and I will be monitored for diarrhea, for little to no urination. Then if those appear, I need to call the provider. As well as I already checked that the patient has no history of Crohn's disease or any intestinal disease or any allergies to aspirin, so it's safe to proceed with this medication. After I'm informing the patient and the patient parents about the medication and the side effects and what I'll be monitoring for, I will be doing my third med check. Okay, so I will also ask the patient if it's okay to use her side table, and if she says yes, I will proceed. So now I'm proceeding with my third med check. Okay, so I will be verifying the order with my patient's wristband. So I have Violet Par. I'm giving clindamycin. The dose is 120 milligrams, which is 2 tablets. Each tablet is 60 milligram, equaling 120 milligram. The route is PO. The time is now. I will document later, and the expiration date is September 2021. Okay. So the order and her wristband and everything matches with the medication. The medication also matches. I have the right dosage. I have the right dosage, and I have the expiration days. Everything is safe to proceed. So since this medication is PO, I will elevate the head of bed to 45 degrees to prevent aspiration. I will be informing patient again that I have in my hand right now 120 milligrams. One tablet is 60 milligrams. She will be having 2 tablets for the dose to be 120 milligrams. Okay, and I will ask the patient, can she swallow? Ask the patient and the parents if she can swallow multiple pills. If she's okay with it, then I'll proceed to give her the medication. And then I will put the medication in a souffle cup, and then I'll give her a cup of water. I took her medication and confirmed that she was able to swallow with no difficulty. After she's done taking her medication, I will lower the bed to the lowest position, put the handrails up. I will open the curtain. I wash my hands. I put the coli near her, and I will document on my MAR about the whole process. Alrighty. Okay, I think I'm done here for my CPE for medical administration for pediatric. Thank you.